Less than a week after calling on the federal government to provide a clear timeline on when Ontario will receive the first doses of a COVID-19 vaccine, the Premier has taken matters into his own hands, speaking directly with pharmaceutical companies about distribution and delivery. But opposition leaders say political meddling could slow down the process, and the government's priority should be getting the vaccine out to the most vulnerable populations. Calling it the largest logistical undertaking in a generation, the Ford government says by December 31st, it will be ready to receive COVID-19 vaccines. But with less than a month to go,
well, I would say that we're still working on the protocols. We're still working on the logistics of delivering the vaccine to people.
Still more questions than answers on delivery, distribution, and who will be the first to receive a shot. Ontario's Minister of Long-Term Care says the most vulnerable populations should be at the front of the line.
I am advocating that our long-term care home residents receive a vaccine in a timely way. I would want them to be a priority.
But the Ford government's still working on step one, securing a delivery date. On Monday, the Premier revealed he has been speaking directly to vaccine manufacturers, including AstraZeneca, Pfizer, and Moderna, after he was unable to get a clear answer on a timeline from the federal government.
This is absolutely critical for planning.
We're very concerned about that. Politicians meddling and interfering doesn't always speed things up.
Today, the Prime Minister confirming Canada will be among the first countries to receive the Moderna COVID-19 vaccine once it has been approved by Health Canada. But the chair of Ontario's Vaccine Distribution Task Force isn't concerned about being the first nation to administer doses.
And although we'd like to have them early, if we don't, we do get an incredible opportunity to learn from their experiences in front of us.
Meanwhile, there's been a concerning 63% increase in hospitalizations in Ontario in the past 4 weeks. The health minister says some hospitals in hot zones are already postponing non-emergency procedures, but the province has been producing more hospital beds since March to handle the volume of extra patients. When asked whether or not the vaccine would be mandatory for healthcare workers,
the Premier has been very clear that he wants this to be a voluntary.
The Premier didn't attend today's update due to a non-COVID-related, non-urgent medical appointment. The Health Minister says the government is collaborating with industry leaders to develop the distribution plan. For instance, today, she toured a pharmaceutical company that could be used to store and distribute the COVID-19 vaccine. The first doses are expected to be made available early in the new year.